So hi, my name is Dr. Dan Marin. I am one of the physicians here at Proform MD. I wanted to take a little moment to talk to you about one of the things we do here, which is some of the practice of orthobiologic medicine, which my partner, Dr. Bill Bonner, may have started to talk a little bit about. What we try to do with that is provide an option or another tool in our tool chest to try to help recuperate patients, diminish inflammation, and prospectively also heal some of the injuries that we've seen. There's data to support that that's been coming out over the last 10 years. I wanted to review real quick and give you guys a little bit of a radiology lecture here real quick on knee pictures and knee ACL injuries, showing how we help our patients and also reduce recuperative time, rehabilitation time, and also cost from surgery, because some of these technologies have been shown to be able to do that. And here's a case point for that. What you're actually looking at right here is my knee. Last year, 1 year ago, a little more than that, in January, I tore my ACL skiing, doing things I shouldn't have been doing, but I did nonetheless. I was looking at having a total knee reconstruction. My knee was read to have a total to near total ACL injury, and I've got 4 kids in a busy practice, and the recuperative time of going into that was pretty scary to me. We were in the process of going through some onboarding with some other doctors who were involved in a research study on ACL and repairs. And so that was an option for me to receive an injection of my own super concentrated plasma, which I did. And so as a result, I went through the rehab protocol, and so I elected to go through this and not go through surgery, which would have been a very expensive and long rehab course. And I just had a repeat MRI, which is the study that's shown here on the right. And it actually shows that I don't anymore have a tear in my ACL, which is a pretty remarkable feat. When I was going through training early on, this probably would have been considered voodoo and not possible, but it's a little different when you can see it with your own eyes and be the person who'd been through it. So this is a study here on the left that you can see. This is a coronal slice, and this is what's called the sagittal slice. And I've take the pictures out, but this is the ACL ligament here. This is the front of the knee, and this is the back of the knee. And the ACL is going from front to back here, and there's this big white spot here in the ACL, and that's the tear that occurred in my ligament at that time. And you can see up here, this was done January 24th, 06, and I'm giving permission for sharing this information. This study over here is the one that I just had done recently, and this was done over a year later. And then you can focus over here on this slice and this series over here, and this is now the ligament, the ACL, and you can see that it goes all the way through from top to bottom, okay? Before, there was this white cut that was through the middle that we no longer see here, which is good. And so just if you were to scroll a little bit back and forth, this is the old study over here. And if you look, there's white. What's white is hot, and what's white is inflamed. And you can see that that's pretty evident here. And then if you pull over here to this study, we're going to go back and forth, and you can see the integrity of the tissue remains full from top to bottom. And so that's really what we would be looking for if we were looking at an MRI after surgery, and also in an intact ligament. So I just wanted to share that because it's been a remarkable experience for me to get back to my function, which I like being active, and I got to keep up with my kids. And the recuperative time was really only about 4 weeks, and comparing to the time out of work and the time to get in to see a specialist and plan for a surgery and then recuperate from a surgery, it's a significant option, which I think should really be available for everybody, especially in a case like this for somebody who's an acceptable candidate. So with that, I just wanted to share that to the community out there so that they would know and know that we offer these things as well. And if we can help, we are a resource here available to you.